frankly, ICD-10 to me is at the top, because that means our livelihood, because that's our money. That's where we get it, the funds to do everything that we're doing. Meaningful use is right up there with it, because there's some incentive to do that. And it's foremost, I think, for all of us, because we've got to worry about those of us that are still trying to finish up stage 1, then stage 2, and all of that. I mean, it's a steep incline to go from stage 1 to stage 2. And then there's still a lot of the very minor details, or I won't say they're minor because they're turning out to be major, but a lot of the details are still being worked out for stage 2. And to be able to meet some of the quality measures, requirements that are there, it's just a tremendous amount of work for us to try to put all this together. Couple that with ACOs, and then trying to make sure that we're running the day-to-day operations, and the reimbursement model is changing, so our staffing levels are having to be adjusted, not just in IT, but throughout the entire organization. For me, and from a small hospital right now, we're running 5 and 6, and all of them are #1 priorities. Because, and when I'm talking to the folks around the executive table, I'm saying, which one do we work on? And, we're looking and we say we have to do all of them. Well, and I was saying this last week to the CEO, I still have the same number of staff that I did in 2008. And trying to do all these things with the same amount of staff is difficult, because we're not getting reimbursed enough to hire more. So, we're still installing an electronic medical record. In our ambulatory environment, we're still installing, so that's a top priority, as well as getting ready for the acute care meaningful use stage 2, and the things that we have to do through that, patient portal. It's just on and on. If we survive this year, if we survive 2014, we're going to have to go through a lot more optimization, because we're throwing a lot of technology at folks that have never used technology before in our organization, because doctors and nurses, in the last 2 years, we have put them on electronic systems, and they have done things via paper for, well, in our organization, for almost 50 years. That's the only way they did them. So they don't even know technology, much less knowing electronic medical records. So we've had to have some very basic computer classes for some of the physicians and some of the nurses. Some of them, this is the first time I've ever used a computer. And I remember, 30 years ago, when I first started learning it, I didn't learn it in a year. It took several years for me to really become adjusted to it. And for us to tell them that your job depends on you doing this and doing it accurately and not killing someone, it's putting a lot of pressure on them. And it's all new to them. And they know they have to do it, but it's still all new to them. From an IT standpoint, those folks require a lot more support than the users that have been using computers for 30 years or 20 years or 10 years. So we're having to spend a lot more time with them, which again puts a lot of strain on our resources.